heavily pregnant patient, Chukwebuka, is here to await delivery at a primary healthcare center in the capital city, Abuja.
There are so many people who could not afford to go to the hospital when they are pregnant. So if they can have a free health facility, at least it will help some of the pregnant women who cannot afford hospital.
This concern explains why the global health body is promoting universal health coverage, which involves a system providing health services for all without financial difficulties. Nigeria, like many other member states of the United Nations, has agreed to work towards worldwide universal health coverage by 2030, thus achieving the Sustainable Development Goal 3, which involves good health and well-being. Dr. Dan Gazama is the head of the Primary Healthcare Monitoring and Evaluation at the FCT Primary Healthcare Board. He says the nation's capital is trying to key into universal health coverage through various health insurance schemes.
Now, every month, the federal government sends money directly to the primary healthcare facilities, selected primary healthcare facilities across the country, in order to strengthen the system, to meet basic needs, okay? Now, don't forget, you cannot achieve universal healthcare coverage without pooling resources. By doing that, you will have sufficient funding that will cater for those that do not have. So reducing out-of-pocket, payment. So it is in light of that the federal government, decided that 1 to 2% of the consolidated revenue is being given for health insurance.
For this professor of public health economics, achieving universal health coverage needs a robust plan involving all stakeholders in the country.
We need to improve things like allocating the right kind of resources towards advancing the universal health coverage agenda. There are the wider investments, like investments in infrastructure, health infrastructure. It will also involve things like our manufacturing sector. What proportion of the drugs that we're going to, of medicines that we use in our system, if we're working towards universal health coverage, what proportion of that should be locally produced?
One central message from many of the industry players in the health sector is the fact that if the government is to really achieve universal health coverage, that it needs to strengthen the primary healthcare system, of course, by providing adequate funding. In Abuja, Toiba Anikoshe, NTA News.